Hello, this is Dr. Mark Hamilton, a facial plastic surgeon here in Indianapolis, and today I'm answering a question I get very often, which is what is the difference between a facelift and a mini facelift? And to answer that question, I think it's easiest first to talk about what is a facelift. And facelift is a little bit of a misnomer in that in general it addresses the lower face and neck. And we have Sophie here today who obviously does not need a facelift, but is a good candidate to show things. And a facelift in general addresses the lower face and the neck. And I like to call it, because of that, a lower facelift. To contrast this with a mid facelift, which addresses the middle third of the face, and a forehead lift, which addresses the upper third of the face. And when we're talking about a lower facelift, there's several techniques in it that are important. We first start off with a facelift by making a small submental incision. And from that incision, I can perform liposuction in the neck, as well as placate the muscle, the platysma muscle, which fans out over the neck, to tighten this neckline. We then also make incisions around the ear, and those incisions go in front of the ear here and here, as well as into the ear canal. And they do very well, very hard to see that incision once it's well healed. In addition, we'll go up into the temporal hairline as well. We also go on the back of the ear and then back along what I like to call the occipital hairline, which allows us to really redrape the neck skin without causing any change in the hairline. Again, all these incisions do very well. From that, we elevate the skin and connect where we elevated in the neck. And the real key to a good facelift is we tighten the deep layer. It's called the superficial musculo-aperneurotic system, SMOS. We tighten that layer by lifting it and then really pulling it very tight to give a long-lasting result. After that, we lift and redrape the skin, removing redundant skin in a very conservative fashion to provide a natural result. And that's the key to having a facelift that looks good but still lasts a long time. Now contrast that to a mini facelift. Typically in a mini facelift, we don't make this submental incision here, or if we do, it's very small and we do limited liposuction. In terms of the incisions around the ear, we will make those in front here typically, or on the back of the ear, but we typically don't make this extension all along the hairline here or go into the temple area. In addition, we can adjust, maybe doing all the incisions behind the ear except for a small one in front to address the neck, or if we're doing an S-type lift, which addresses the cheek, just making incisions here and here in front and a little incision on the back. In addition, we don't have the extensive elevation, it's more minor skin elevation. And that SMOS, that deep tissue, we do work on it, but it's usually much more limited, sometimes just folding it on itself. So what are the advantages of a mini facelift? Well, first of all, there's a lot less downtime. Now, if you watch our other videos, you've seen a typical facelift. Most patients are really pretty good by 2 weeks, certainly with makeup. With a mini facelift, a lot of times patients will be doing things after a week. In addition, there's less risk. So for patients that can do a mini facelift, it's a great option. So what are the indications for a facelift and a mini facelift? In general, for a facelift, we consider it for patients who have quite a bit of extra skin in the neck, that banding that we talked about, the platysma, or a lot of excess fatty tissue. Also, jowling along the jawline is an indication for a lower facelift, and skin redundancy in the lower face. For a mini facelift, they typically don't have much, if any, skin redundancy in the neck, certainly no major platysmal banding, early jowling, and early skin laxity. In those situations, you can get away with a more limited mini facelift. So this has been Dr. Mark Hamilton talking about facelift versus mini facelift. And the first step is to deciding which is right for you is to have a consultation with a board-certified facial plastic surgeon.